Both my partner and I are here to present some most common digestive disorders that you're probably familiar with or know somebody that has some of those symptoms. But what I wanted to start with is regarding trusting your tummy or trusting your body. I always tell my patients that our body tells us everything we need to know, except most of the time we ignore it. And especially after surgery, what you need to always remember, and I tell my patients, listen to your body. It tells you everything you need to know. Don't ignore it this time. So if, let's say, after an abdominal operation, if you look at a certain food and it makes you nauseous, don't eat it. That's your body telling you, don't eat it. Or if you're feeling very weak and you started walking and you need some rest, rest a little bit and then continue to walk. Listen to your body. It's really important. And so this whole discussion is going to concentrate on different symptoms that are very common. Most of us have them at some point or another, and when we should pay attention to them. For instance, I'm sure all of you experience gas, burping, bloating, heartburn, diarrhea, constipation. It's very common, but we tend to suffer silently and we don't share necessarily because we're a little embarrassed about it. But some of those symptoms can be treated, and that's what's important here, because there are treatments out there, and you need to be aware of them. So talk to other people, go to your physicians, and talk and tell them about your symptoms that maybe can be treated. For the most common digestive disorders with regard to symptoms, causes, and risk factors, as well as how to prevent or treat those digestive disorders and how to maintain a healthy digestive system. When we eat, everything we eat goes into our body and it's being digested. And that food is what provides us with the nutrients and energy. A healthy digestive system really allows us to have a non-disruptive daily activities. And it's very important. If you have, however, a problem with the digestive system, for instance, pain, discomfort, different accidents that can lead to serious problems and complication in your life. So if you do, talk about it and go and seek some help. The diagnosis that we're going to cover today, especially just a few words about each one, will be gastroesophageal reflux disease, as you just heard about, which can lead and does lead sometimes to esophageal cancer. In fact, 30% of the patient who develop esophageal cancer have or suffered for many years from gastroesophageal reflux disease or acid reflux. So this is really important, and most patients don't know that. As well as gallbladder disease, pancreatitis, chronic constipation, diverticular disease, and colorectal cancer. Reflux, it's usually chronic. If you have more than two episodes of reflux a week, you have the diagnosis of GERD. And so if you have that and you find yourself on medication for a prolonged period of time, the FDA approved the PPIs, which is the proton pump inhibitors, for 2 weeks treatment. If you require more than 2 weeks of treatment, you should seek a more curative treatment, which is not medication. And my partner and colleague is going to talk to you more about reflux and the treatment or surgical point of a part of the treatment. Causes of reflux, nobody knows. Not that we know what can lead to it. For instance, like hiatal hernia. If you have a hiatal hernia, you have a defect, you have the diaphragm, you have a little opening for the esophagus to come into the abdomen, and then you have the stomach in the abdomen. Different pressure. Physiologically, we have higher pressures in the abdomen than in the chest. If you have a hiatal hernia, which can be developed because patient might be overweight, so a lot of pressure, physiologically it is higher pressure, you add a little bit of weight to the abdomen, you increase the pressure and compresses the stomach, but also pushes the stomach up into the chest and can increase the hiatus that allows the esophagus to come down into the abdomen. So being overweight can lead to that. Lifting heavy weight can lead to that. Chronic constipation, where you're straining all the time and causes increase in the abdominal pressure, can lead to hiatal hernia. But once you have hiatal hernia, you already are now shifting most of the time the sphincter or the lower esophageal sphincter, which is like a ring of muscle, So a ring of muscle that is contract and relaxes and therefore prevents the acid from coming up. So when you eat, it relaxes, allow the food to go into the stomach, and then it contracts to prevent the acid from refluxing. However, in patients with reflux, it's constantly relaxed. That means if it's not functioning well and now you're putting it in a lower pressure system, which is in the chest because you have hiatal hernia, it's going to exacerbate your symptoms. So hiatal hernia can lead to or exacerbate reflux, but we don't really know what the cause of GERD. The treatment, as I mentioned before, relief of symptoms can be achieved depending on to what level your reflux is with lifestyle changes. If you smoke, you should stop smoking. If you drink alcohol, you should stop drinking alcohol, or to a certain extent that causes you trouble. Or if you are overweight, you need to be on a strict diet and lose the weight because that exacerbates it. If you have certain trigger foods like spicy food or carbonated drinks or caffeinated drinks, all of those, and all of you that have reflux are probably very familiar with those trigger foods, and so you need to avoid them. And then there's the medications, as mentioned before, and Dr. Ross McGee is going to talk also about some of the side effects of those medications that now 20 years later, since they developed, we know more about the side effects and how hazardous they are to our health, why we shouldn't be really relying on them long term. And then, of course, the issue regarding cure. The only cure that you can have with a mechanical problem, which is what you have in the lower esophageal sphincter, is with a mechanical solution, which will be an operation. And again, Dr. Ross McGee will talk to you more about the operation for reflux. Gallbladder disease. Patients or people would usually come and complain about nausea, some vomiting, bloating, and constant right upper quadrant pain, which is usually very constant after it starts, but it comes about after you ate something fatty. If you eat something fatty, the gallbladder gets the order to contract and release a bolus of bile, and then it helps digest the fat. If you have a problem with your gallbladder, if your gallstone that lodges at the opening of the gallbladder into the common bile duct, which releases the bile to the small bowel, if you have any obstruction like that causes severe pain, that's when you have those symptoms of abdominal pain that sometimes will radiate to the back of your shoulder and can have the nausea and vomiting, the bloating and everything that comes with it. But it usually develops 30 minutes to an hour after you eat, or sometimes if you eat something fatty at night, it wakes you up at night. And so those are some of the common symptoms with gallbladder disease. And the diagnosis really is with the history. Hey, I had some, McDonald's, or I had like fried something, and some French fries, anything that you go out to eat has a lot usually of fat with a lot of cheese. Any one of them, if you have gallbladder disease, can lead to those symptoms. So if you had the history, physical exam, you have tenderness in the right upper quadrant upon palpitation, once we touch it and press, right upper quadrant ultrasound, not necessarily needed, but many times when many physicians will order it, and that can show if you had inflammation of the gallbladder, cholecystitis, will have some signs that will indicate that you have that, as well as gallstones. So it gives us some indication as to how severe your problem is. And HIDA scan, it gives us more information about the function of the gallbladder, or if you have a problem with it. The treatment, once again, for any gallbladder disease is removal. It's an organ we don't really need. It's just used for storage of bile. Pancreatitis, it's really inflammation of the pancreas, and it's relatively common. The two most common causes of pancreatitis are gallbladder stones and alcohol. And we know in our society that there's a lot of social alcohol drinkers, and many of them can develop pancreatitis as a result. The treatment is really supportive. There's no magic pill for pancreatitis. You just have to kind of keep the patients from eating, just give them the IV fluid, give them some time to recover, and most of the time they recover without any further treatment. If their events occur more and more, that's when we call it chronic pancreatitis, and that's when it becomes more debilitating. You have abdominal pain that is just chronic. It's an awful diagnosis to live with when it's becoming chronic. And the treatment is very similar. It's usually very supportive. Let the bowel rest and let the body kind of recuperate. Chronic constipation, many of us suffer from it. It's most common among women. And the management is really, when it comes to the diet, is adding fiber to your diet, increasing fluid intake. We always forget to drink or drink the right things. And exercise. We always need to remember that exercise is very important. Diverticular disease. Diverticular disease is when you have an outpouching of the colon. And that doesn't necessarily cause pain, but when patients have constipation, suffer from chronic constipation, that's when that can happen. Diverticulitis, and when you have inflammation of those outpouching, and when you have attacks that are repeated on themselves, that's when you would think about surgery as the treatment. But otherwise, it's usually treatment with medication and antibiotics. Colorectal cancer is unfortunately common, and it doesn't give you any pain, no symptoms of pain necessarily unless you obstruct it. It grew so big that it caused obstruction, and it depends where along the colon you develop the cancer. But many times you'll just be diagnosed with blood in the stool or weight loss. So it's very nonspecific. That's why it's important to be screened after the age of 50, and we'll talk about the screening tests. Some of the causes, we don't know. We know the risk factors, but we don't know the actual causes. These are some of the tests that you should go to your physicians, your primary physicians, and pretty much demand. After the age of 50, you should have a colonoscopy every 10 years. You should have flexible sigmoidoscopy every 5 years, barium enema every 5 years, fecal occult blood testing, which is just testing for blood in the stool every year. And now there's a new test, relatively new because it's been around, virtual colonoscopy, where you don't have to go through the pain or have a colonoscope there with insufflation, rather do it via virtual or like a CT scan, and it looks at your colon. And so you really should check for that. And like I said before, you may not have any, much symptoms, but just blood in your stool, and it might not be so obvious, but you need to take care of it. There are some non-controllable and then controllable risk factors. I'd like to concentrate on the controllable risk factors because those are the ones that you can actually change and control. One of them is being overweight. I mean, BMI in America is a huge issue. Many patients that come to our clinic, we have a whole set of a diet there to offer because most patients have to work on losing weight, and they have great outcomes once we work on losing weight. So anybody who's overweight really should get into a program where we're working on losing the weight, because that would alleviate many of the symptoms that many of us experience. Unhealthy lifestyle habits like smoking, nobody should smoke today. I smoked in the military for 2 years because I didn't like people telling me what to do. But I stopped right after the military, but I was a heavy smoker. I was 3 packs a day. If you can imagine, I would be like one after the other. So it's not a good habit, and I really worked hard on stopping immediately after. If there's no reason to smoke, just don't smoke, but that's the only thing I could control in the military, so which was my health. So smoking, stop smoking if you do smoke. Exercise, try to exercise. I try to push myself every Sunday to go exercise, but really you should exercise every other day, or sometimes every day if it's just for 15 or 30 minutes. Poor diet and eating habits. Oh, that's so important, especially with our diet here. So many fast foods. It's so quick to just go and get something that is really not healthy, that you have to pay for a long time afterward. And so really think about what's important. And there's a whole other speech that I can give you about just good nutrition and healthy nutrition, which does not exist in the fast food restaurants. High stress level, as you heard from Wendy Ryan. I mean, it is a problem. We all are pushed to succeed, and there's a lot of stress. And so we have to try to manage it, as well as excessive alcohol consumption. We gotta limit our alcohol, daily alcohol. So what can you do? You can go to your doctors, you can get your physical exam, complete review of the family history, test and screening, as I mentioned before. You should demand them and clearly describe your symptoms. Don't hide them, don't be embarrassed. You have to develop a plan. And by telling them your symptoms, you're telling your primary physician, You will get the blood tests that are necessary, the stool test, abdominal ultrasound, barium swallow x-rays, etc. If you just go along the list of tests that can be undertaken according to the symptoms that you may experience. What can you do? As I mentioned before, eat healthy. Don't smoke. Exercise when you can, reduce your stress, and then remember the do's and don'ts. And it's funny because I do all the don'ts, but the do is get enough sleep, eat smaller meals. I do that, but all day. Eat and drink slowly and get moving, exercise. What you don't want to do is eat before bed or lie down after you eat. I actually eat in bed. But don't do that. It's not good for you. Remember, a healthy digestive system is within reach. As you read here, live well and trust your tummy, because it tells you, trust your body. It tells you everything you need to know. Just remember, don't ignore it. Thank you.